I think it's extremely important for us, in the next, coming weeks and months, to paint a very accurate picture for the American people about what our health care system is going to look like, what our federal budget is going to look like, the effect on American jobs, on our economy, and really the effect on our freedoms that we are going to witness if this health care law is fully implemented.
President Obama, an exact quote to the joint session of Congress when he was promoting this legislation, not some off-the-cuff figure, said this: "Now, add it all up, and the plan that I'm proposing will cost around $900 billion over 10 years. Now, this was a deliberate attempt, as has been suggested, to manipulate the figures because the taxes started right away, but the spending was 4 years delayed, essentially. So you only have 6 years of really spending under the plan. And it also excluded many other provisions. For example, the bureaucratic implementation costs were not counted. The amount of effort, even IRS people that have to be involved, was not counted. New spending to close the Medicare donut hole. We didn't have the money in 2002 or 3 when we passed the prescription drug bill to fund that money. Now we've never been in worse shape. We're borrowing 40 cents of every dollar we spend, far worse than we were. Next year will be the 5th consecutive $1 trillion deficit. We don't have the money. Once you add up all the different provisions in the health care law, the total gross spending over the original 10 years, not when only 6 years is being paid for, over 10 years is actually $1.4 trillion. That's the numbers we have. So this was a misrepresentation. This is through from 2009 through 2019, $1.4 trillion.
Well, Senator Sessions, I want to ask you a question. So we've talked about this in the past. Part of my getting here, I know that a lot of people talked about this, the Medicare cuts being double counted. And I never quite understood exactly what that was. Can you maybe explain a little bit to the American people what that means?
Yes. As a part of the funding for the health Obamacare legislation, there was an increase in Medicare taxes and a cut in Medicare benefits, totaling $400 billion. That money was used to fund the new health care bill by the U.S. Treasury, an entirely new program. But it's Medicare money. It's not the Treasury's money. Medicare has trustees. Medicare loaned the money to the U.S. Treasury. It was borrowed money that's used to fund this bill, not money that came in new and free of charge. And since Medicare is going into default and going to claim its debt in a few years, the federal government is simply going to have to either raise taxes, cut spending somewhere else, or more likely convert the borrowing from Medicare, borrow money on the open market from China and other places, and then pay Medicare back. So it's really, as the CBO director told me in a letter December 23rd, the night before we voted, you're double counting the money. No wonder this country is going broke.
Do you believe that those Medicare savings will actually be realized? Do you believe Congress will actually enact those savings?
Well, that's a good point, because in the past we've attempted and claimed we're going to make savings in Medicare, and they never occur. So what I'm saying is, if the savings were to occur, and if the new taxes on Medicare go into effect, as they are, that money is what's being used to fund an entirely new health care program. And there is real doubt that it will ever achieve those savings in Medicare, because if you keep cutting doctors and you keep cutting hospitals, they can't keep doing work. They will just start refusing Medicare, Medicaid work. And we're in that position already on some of the cuts that we rescind every year, because we know that the health care system would collapse if those cuts were to go into effect.
There's no doubt about it. We're facing a serious crisis. Healthcare costs are crippling Americans. Many Americans lack access to quality health care. It's stifling our nation's overall economic development. there are real difficulties with physicians and hospitals that they face when it comes to accessibility and affordability of health care services. Far from creating jobs as the President promised, it's estimated the law will actually result in 800,000 fewer jobs over the next decade. It's almost as if the law was written with no input from America's small business owners and the health care providers that will run it.
The essence of the President's proposal, it went to the core of the proposal financially, was that by federal government expansion of our authority, we would bend the cost curve and make health care cheaper for all Americans. Now, that was a fundamental principle that was sold to business people, and some business people thought it was a great idea, but it hasn't happened. Already, the premiums in private health care in America has gone up $2,000, almost $200 a month, and we're going to see it continue to go up. It does not bend the cost curve down. In fact, we've seen the opposite to occur. We have to know that our per-person government debt, Senator Johnson's on the Budget Committee, and he knows this, is worse than any other Western world nation. Per capita, we have more debt than Greece, Spain, Italy, Ireland. $44,000 per person we all owe, man, woman, and child.
Remember, Obamacare has not been fully implemented yet. So what happens when you calculate its full cost when truly implemented? The Budget Committee, on which Senator Sessions sits, says total spending under Obamacare will reach $2.6 trillion. So these are the real costs that we have to pay attention to, not just the estimates that were made at the time they were trying to get the law passed.
Do you know who enforces this thing? At the end of the year, if you don't sign up, if you don't put on your tax return, which I assume it will be in terms of what kind of coverage you have, it's the IRS. The IRS is going to be the enforcement entity in regards to whether or not you have a provider, and if you don't, you get fined.
I think the bottom line of this health care law is it is basically going to increase demand while at the same time reducing supply. That's not a good thing. It's certainly not the way you bend the cost curve down. Senator Sessions, you have a few more comments.
We do not have the money. It's going to make health care worse, as we've heard, but more than that, we simply, even if it were a good idea, a nice thing to have, we do not have the money. We're borrowing 40 cents of every dollar we spend. And they've misrepresented the cost. It's far higher than anyone has expected, and it's going to continue. I'm concerned about the cost, and I know Senator Boozman and others have talked about the rationing, and there's a lot of reasons why we simply cannot go forward with this health care bill. It must be eliminated as we know it, and we can make reforms, but this legislation cannot go into effect.